So very good morning to all of you. Am I visible and audible to you people? Let me confirm if I'm clearly visible and audible to you people so I can start the lecture. Just give me a second, 1 second only. If I'm clearly visible and audible to you people, you can give me a thumbs up so I can start ahead. Okay. So I welcome you all for this session. I am Dr. Priyanka Sachdev here, NEET PG educator on Unacademy. So today I am here to continue my Pharma series. I have launched this Pharma series for you people. In this series, that is Pharma-Once Daily. Daily I take one system, one chapter, small portion from the pharmacology, and we discuss its classification, its action, uses, side effects, and contraindications. So I have started autonomic nervous system, the most difficult system in pharmacology, I guess. So we have already done one chapter in this. We have started the first chapter we have done on Saturday. We have done the basics and general of autonomic nervous system and classifications. So today I am starting the first chapter in it. The first chapter in it means cholinergic drugs, also known as parasympathomimetic. These are parasympathomimetic drugs. So all the chapters, not only this one, that is my way of teaching. In all the chapters, I suggest you to make a comparative table to all 4 chapters. In this ANS, I will teach you 4 chapters: cholinergic drugs, anticholinergic drugs, adrenergic drugs. Adrenergic drugs will be of 2 types: alpha agonist and beta agonist, and anti-adrenergic drugs. Again, these will be of 2 types: alpha blockers and beta blockers. So I suggest you to make a comparative table between these drugs, and I will teach you in this way. First, I will tell you the classification of each class. Then I will tell you mechanism of action. Then I will tell you the actions of those prototype drug. Whatever prototype drug is there, from that will be the action. Then uses, mnemonics if applicable in uses, then contraindications and side effects. To make a comparative table and summarize your all 4 chapters over one big sheet. That is my suggestion to you. So I'm starting with the first chapter, cholinergic drugs. So let me start with the classification of cholinergic drugs. So let me tell you, cholinergic drugs are of 2 types. This is a diagram which I have already explained in my last lecture. Those who have missed it, please watch the first recording, episode number 1 of this Pharma-Once Daily. So you can see this is the brain, this is the spinal cord, this is the central nervous system, CNS is there. So see the parasympathetic system here. So this is one of the neuron, cell body of the neuron, which is present in the central nervous system, and axon is coming out. That axon is known as nerve. So this is the preganglionic nerve fiber. And here synapse is there. There is a junction synapse which is known as ganglion. Synapse is known as ganglion. And here another neuron is there. This is the cell body and this is the nerve fiber. Axon is known as nerve fiber. So this is postganglionic nerve fiber, you can see. So preganglionic, postganglionic nerve fibers, and they are supplying to organs which are involuntary, that is smooth muscles. Smooth muscles means involuntary muscles. They are supplying to the involuntary muscles. So that is about the parasympathetic system. Now what is the neurotransmitter secreted here? So there are 2 neurotransmitters, one at the preganglionic junction, one at the postganglionic effector organ. At both the places you can see here neurotransmitter is acetylcholine only. Compare it with sympathetic system. In sympathetic system, at preganglionic neurotransmitter is acetylcholine only, but at postganglion the neurotransmitter is noradrenaline. Currently my topic for teaching to you is parasympathetic system. So it is the acetylcholine. It is the acetylcholine which is the neurotransmitter for today. Done. So I am going to teach you this. These basics have already been covered by me in the last lecture. Now I have to tell you the classification of the drugs. Now what are cholinergic drugs? So what are cholinergic drugs? That is parasympathomimetic drugs. What are those? The drugs are of 2 types, D1 and D2. Here you can see I have drawn D1 for you, and here you can see I have drawn D2. What are D1 drugs? D1 are structurally similar to acetylcholine. So whenever I take a tablet of a drug D1 here, so that will go inside my blood, stomach and esophagus, stomach and intestine. It will be absorbed, it will go in my blood. From blood, it will go to these junctions, nerve and muscle junction, smooth muscle junction. So that drug is structurally similar to acetylcholine only. So the muscarinic and nicotinic receptors, M and N receptors present on the organ, they will think that this drug is acetylcholine only. So this drug will combine with muscarinic and nicotinic receptor and show the same action as acetylcholine was showing here. So if it is a heart, it will decrease the heart rate. If it is a salivary gland, it will increase the secretion. If it is a eye, it is a pupil of the eye, it will contract it. It will cause meiosis. So whatever organ it is, whatever action acetylcholine was showing on that organ, the same action is shown by the drug. The D1 drug is known as agonist. It is known as cholinergic agonist. Cholinergic agonist. It is showing the same action as acetylcholine is showing because it is structurally similar. It is the hamshakal of acetylcholine. Done. That is drug number 1. Normally acetylcholine, you have seen the green color molecule, acetylcholine is secreted here and it acts on muscarinic and nicotinic receptor. After its action, it is destroyed by an enzyme. The name of the enzyme is acetylcholine esterase. This red color enzyme I have drawn here. So the name of the enzyme here is acetylcholine esterase. Normally it destroys the acetylcholine after it shows its action. Now I am talking about drug 2. What is this drug 2? This drug 2, if I am taking a tablet of this drug 2, it is getting absorbed inside me. It is going in the blood. From the blood, it is going to these junctions at the nerve and muscle junction. So it is not structurally similar to acetylcholine. So it cannot bind to muscarinic and nicotinic receptor like the drug D1. It is not structurally similar. What this drug will do? This drug will inhibit the enzyme known as acetylcholine esterase. So what will happen? What will happen if this enzyme is inhibited? Normally this enzyme was destroying acetylcholine. Now if this enzyme is inhibited by the drug, acetylcholine is not destroyed. So the endogenous natural acetylcholine will remain at muscarinic and nicotinic receptor for a longer duration. So again it is showing cholinergic action. So that is drug D2. This D2 drug is known as anticholine esterase. This D2 drug is known as antichol because it is inhibiting choline esterase enzyme. Anticholine esterase drugs. So there are two type of drugs. Here you can see I have drawn drug 1. Everyone see here, drug 1. It is structurally similar to this acetylcholine only. You can see this is acetylcholine. So it will bind to muscarinic or nicotinic receptor in the same way as acetylcholine is doing. It is agonist. It is cholinergic agonist. The name of the category is cholinergic agonist. And here you can see drug 2. Please see drug 2. What it is doing? It is not structurally similar to acetylcholine. So it cannot bind to muscarinic and nicotinic receptor. It will inhibit the enzyme known as choline esterase. So if choline esterase is inhibited by this drug, then acetylcholine will remain at the receptor for a longer duration because the enzyme which used to destroy it is inhibited. So these drugs are known as anticholine esterase drugs because it is inhibiting choline esterase. So anticholine esterase drugs. So that is drug 2. So there are two type of drugs, cholinergic agonist, that is D1, and anticholine esterase D2. Don't get confused. This anticholine esterase is not anticholinergic drugs. These are anticholine esterase drugs. So this is the classification in front of you. Let me tell you the classification quickly. Then we will come on the next heading. So cholinergic agonists are there and anticholine esterase are there. Now the question arises for D2. This is a D2 now. So this is a drug D2 which is inhibiting the enzyme. Now it can be of two types. It is inhibiting the enzyme whether it is reversibly inhibiting or whether it is irreversibly inhibiting. So carbamates inhibited reversibly and phosphates inhibited organophosphates inhibited irreversibly. So D2 anticholine esterase are of two types, reversible inhibitors, irreversible inhibitors. रिवर्सिबल में कार्बामेट्स आएंगे और irreversible में organophosphates आएंगे. Please learn it. रिवर्सिबल में कार्बामेट्स and irreversible में organophosphates. Both of them inhibit the enzyme, but whether reversibly or irreversibly. So cholinergic agonist में आपके esters और alkaloids दो टाइप के आएंगे depending on the chemical composition. So acetylcholine is the natural acetylcholine तो होता ही है. This is artificial acetylcholine. Methacholine, carbachol, bethanechol. And alkaloids में muscarine, pilocarpine, arecolin. So these are cholinergic agonists. And anticholine esterase reversible में carbamates आएंगे. So these are the carbamates in front of you. Physostigmine, neostigmine, pyridostigmine, adrophonium, rivastigmine, donazepam, galantamine. You have to say it again and again for learning it. And irreversible में there will be organophosphates, there will be diphlos, there can be malathion, parathion, and diazinon. So these are the poisons which are present in the pesticides and all. So these are organophosphates. So you have to learn the classification. So now you know the names of the drugs, that is cholinergic agonist, and you know the name of the categories of reversible inhibitors also and irreversible inhibitors also. Reversible are carbamates, irreversible are organophosphates. You should learn the classification. I hope I'm clear in classification. Let me tell you the mechanism of action. I have already told you mechanism of action of both the categories. So just a second, give me 1 second. Okay. So mechanism of action of both the categories. So this is the mechanism of action of cholinergic agonist. They are structurally similar to acetylcholine. I have already told you they are structurally similar. So they will go at the junction. They will act on muscarinic and nicotinic receptor, stimulate these receptors and produces the action which are similar to acetylcholine only. That is the mechanism. And mechanism of action of second type, that is anticholine esterase drug, that is D2 drug. What it will do? It will go at the junction and it will inhibit the enzyme cholinesterase. So this enzyme will not function. Normally this enzyme hydrolysis causes the destruction of acetylcholine. Now acetylcholine will not be destroyed because the enzyme used to destroy it or hydrolyze it is inhibited by the drug. So the acetylcholine will be protected. So the action of endogenous acetylcholine, natural acetylcholine, is potentiated. So this is how it is producing cholinergic action. So that is the mechanism of action. And here inhibitors are of two types. Carbamates are there. Carbamates, they will inhibit the enzyme only for 30 minutes to 6 hours. That is reversible. That is reversible inhibitors because after 30 minutes to 6 hours, the enzyme will be it will be reactivated, you can say. So carbamylated enzyme will be reactivated after 6 hours. And organophosphates, it takes 100 of hours to reactivate the enzyme. So 100 means almost irreversible. So it is causing irreversible inhibition of the enzyme. So phosphorylated enzyme, it takes 100 hours for hydrolysis or for reactivation of the enzyme. So drug 2 is of two types. It can be carbamate, it can be organophosphate. This one is reversible. It takes 30 minutes to 6 hours for reactivation of the enzyme, and it is irreversible. It takes almost more than 100 hours, so it is almost irreversible. Organophosphates are irreversible. So I have done with the classification. Classification should be at the tip of your tongue. At the tip of your tongue, the two categories: name cholinergic agonist. You should be fast enough to tell, ma'am, this, and this. There are 5 or 6 cholinergic agonists. And name the anticholinesterase drugs. So you should be able to tell me, ma'am, reversible ones are carbamates and these are the drugs, and irreversible ones are organophosphates and these are the drugs. So classification should be at the tip of each of you. Done. So say it again and again to learn. Mechanism of action I have already taught you. Now coming on actions. To understand the action of both of these, whether it is cholinergic agonist or anticholinesterase, you should understand this table. This table I have already discussed in my last lecture. I will just briefly give you the overview and then tell you the actions in short. After actions, I will come on uses, side effects and contraindication. I will give you many mnemonics there. So let me tell you the actions. The actions are in front of you. There are 3 types of muscarinic receptors, M1, M2, M3, and 2 types of nicotinic receptors, NM and NN. Let me talk about muscarinic first. So M1, M2 and M3 are the 3 types of muscarinic receptors. M1 present in the CNS for memory, in the stomach for acid production. M2 present only in one organ, heart, and M3 present in many organs. This we have seen in the visceral smooth muscle, eye, glands, blood vessels and male sex organs. So I have told you a mnemonic also in the last lecture. Anyone knows that mnemonic? So pehle khao, that is stomach. Fir dil lagao, that is heart. Baki sab kaam baad mein. So that is M3. So let me tell you the action one by one. So where I will start, M1 is not really very important. I will start from M2. M2 is present on heart. So on heart, we have M2 receptors. So when acetylcholine is secreted and it binds with the M2 receptors on heart, what it does, that acetylcholine does reduction in the heart rate, reduction in the contraction, reduction in the velocity. So heart rate, force of contraction and velocity of conduction, all 3 things are reduced. You know heart rate is known as chronotropic effect, velocity of conduction is known as dromotropic effect, and force of contraction is known as inotropic effect. So can I say acetylcholine is negative chronotropic, or these drugs, cholinergic drugs, are negative chronotropic, negative dromotropic and negative inotropic, because they are decreasing heart rate, force and velocity, all of them. So that's why these are negative. So let me draw a diagram for you. So these are the 4 chambers of the heart you can see, especially see the left side. On the left side, this is the left ventricle. This is the wall of the left ventricle. On the wall of the left ventricle, M2 receptors are present. You can see M2 receptors. So when these all are M2. So when these drugs are going inside the blood, these drugs will bind with the M2 receptors. These are cholinergic drugs. After binding the M2 receptors, it will decrease the heart rate, it will decrease the velocity of conduction, it will decrease the force of contraction. So these drugs are negative chronotropic, negative dromotropic, negative inotropic. Give me a thumbs up. I tried my best. That is mechanism of action on heart. So M1 I'm not explaining in detail. M2 is done. Coming on M3 now. M3 receptors are present where and where? Take one by one. So first I am taking visceral smooth muscle. Now this is difficult. Visceral smooth muscle is present at many organs in the body. I will discuss three organs: GIT, urinary bladder, and lung. Three organs. Let me talk about three organs one by one. Can you see this is GIT? Can you see? Yes, you all can see. Can you see this is colon? This is ascending colon. This is transverse colon, and this is descending. This is descending colon, sigmoid, rectum, and this is the anal canal, and this is the sphincter. This is the sphincter present here. Sphincter. So what these drugs do? Now there are two things. Muscles are present at here in the wall of the intestine also, which causes peristalsis, and muscles are present in the sphincter also. So two different muscles are present. One, the muscles present in the wall of the intestine, muscularis propria, and the muscles which are present in the sphincter. So if these, so M3 receptors, first thing you have to learn is M3 receptor is present over both the muscles. So muscles over the sphincter also have M3 receptor, and muscles over the wall of the intestine also have M3 receptor. So when these drugs, we take these drugs, so these drugs are going, they will bind with the M3 receptor here on the muscle also and on the sphincter also. Now they have opposite action. These drugs increase contraction of the muscles present in the wall of the intestine, and relaxation, decrease contraction, and they causes the relaxation of the sphincter muscles. So these drugs, what will happen? The muscle will contract of the small intestine wall and the sphincter will relax, so pieces will pass. So patient is able to pass the pieces. So because peristalsis will be increased because of contraction of the muscle in the wall, and the sphincter will be relaxed. So peristalsis is doing and sphincter is relaxed. So pieces will be passed. So these drugs are helpful. These drugs are useful for constipation. Have you got it? So that is the muscle contraction. Smooth muscle contraction is there. Smooth muscle contraction and sphincter relaxation in GIT. So in abdominal cramps, in evacuation of the bowel, in constipation, these drugs are useful. That is about the GIT. Coming on the urinary bladder, you can see here. Let me draw a diagram for you. A urinary bladder diagram for you. So can you see, this is the urinary bladder and this is the urethra and this is the sphincter. Same diagram. So two type of muscles are there. Again here also, the muscles which are present in the wall of the urinary bladder, these are known as detrusor muscle, and the muscle which is present over the sphincter, this is known as sphincter muscle. Sphincter. So both of them having M3 receptor. So M3 receptor are present over here also, and M3 receptors are present over here also, M3 receptors. So whenever you will take the drug will combine with M3 receptor here also and M3 receptor here also, but opposite action will be done in the same way as with GIT. So here drug increases contraction in the wall, detrusor muscle, and here it causes relaxation in the sphincter. So what will happen? You will take, you tell me, the muscle here will contract. So detrusor muscle will contract and sphincter will be relaxed. So urine will be passed out. So these drugs are useful in urinary retention. So these drugs are useful. Give me a thumbs up if you got it. Give me a thumbs up. A big concept. I have explained you a very big concept. A very big concept. Very beautifully I tried to explain it. Done. Done. So about the GIT I am clear. Detrusor muscle contract and sphincter relax. So increases micturition. Done. And last is lungs. In lungs, we don't have sphincter. Let me draw a diagram. So these are the two lungs you can see. This is trachea, this is bronchi, and these are the alveoli. So smooth muscles. So all the muscles here, the receptors which are present is again M3. So drug will bind with the receptor and it will cause contraction of the lungs. There is no sphincter in the lungs. So contraction of the bronchial muscles. So we cannot give these drugs to patients with asthma. Otherwise, the attack of asthma is precipitated. So that was all about the visceral smooth muscles. What is the summary? What is the summary? The summary is that you can see in GIT also, in urinary bladder also, the muscle in the wall of the GIT and the muscle in the wall of the urinary bladder contract, and the sphincter of both of these, GIT also, urinary bladder also, sphincter relax. So it causes feces to pass out, it causes urine to pass out. So useful in constipation, useful in urinary retention. And what about lung? In lung, it causes contraction, so it is contraindicated in asthma. So all this information is gathered from here. So let me come on the another organ, eye. The second organ here is eye. Give me a thumbs up if you got. Now eye is difficult. I will try my best to explain you. I will explain you eye, that is iris and ciliary muscle action, not only of this chapter, cholinergic. I will tell you all 4 chapters together. Cholinergic, anticholinergic, adrenergic, anti-adrenergic. So which drug causes meiosis? Which drug causes mydriasis? Which increases intraocular tension? Which decreases intraocular tension? So that depends on iris and ciliary muscle contraction and relaxation. So let me talk about the first chapter. So there are 2 type of muscles in the eye, iris muscle and ciliary muscle. Let me talk about iris muscle first. You know, eye is like a ball, so it is like a spherical ball. You know, it is a 3 dimension. So in the center there is a curtain. You can see curtain with a hole. This is the hole in the curtain. This is a circular curtain. This circular curtain is known as iris. You can see the pigmentation in the iris will give you the color in the eye. So it is black, brown, blue is due to the pigmentation in the iris. So this is iris. Iris has a hole in the center. That is known as pupil. You can see the curtain here with a hole. This is the curtain. I have cut it half like this. So you can see the curtain with a hole. So that is known as iris. Let me draw the iris separately. So see this iris. See the first diagram. See this iris. You can see a hole and you can see the curtain. This is iris. Iris has 2 types of muscles. Iris has 2 types of muscle. See, these are the longitudinal muscles known as radial muscles. So when they will contract, they will dilate the pupil. So these are known as dilated pupillae. And the second one, let me draw with another color. You can see in between. These are known as circular muscles. So when they will contract, they will decrease the size of the pupil. So these are known as sphincter pupillae. Let me draw it separately. Let me explain first, then I will draw the diagram. So dilated pupillae and sphincter pupillae. Yes. So dilated pupillae is supplied. Both of them are supplied by nerve. Dilated pupillae is supplied by parasympathetic fibers. And sympathetic pupillae is supplied by sphincter pupillae is supplied by sympathetic fibers. Let me draw separately to explain you. It is difficult. I am saying it is difficult. So you see this is the pupil. You see this is the iris. Please everyone understand this once for all. So there are 2 type of muscles. This is dilated pupillae. These are radial muscles. You can see. Let me draw first few of them. So these are dilated pupillae. So imagine all of them are contracting. So when they contract, they cause mydriasis. They will increase the size of the pupil. No? When they will contract, the size of the pupil will increase. Yes or no? So these are known as dilated pupillae. The name of these muscles is dilated pupillae. Done. And the second type of muscles, these are the circular muscles. These are circular muscles. Now imagine when they will contract. These circular muscles will contract. So they decrease the size of the pupil. That's why these are known as sphincter pupillae. So 2 types of muscles, dilated pupillae, sphincter pupillae. Okay. So let me draw, both of them are supplied by nerves. So let me draw a nerve here also. It is supplying the dilated pupillae. Let me draw a nerve here also. It is supplying sphincter pupillae. The yellow colored are the nerves. So which nerves? Dilated pupillae is supplied by parasympathetic fibers and sphincter pupillae is supplied by sympathetic fibers. So tell me what will happen when parasympathetic system is stimulated. Which muscle will be stimulated? Dilated pupillae. So when acetylcholine is there, parasympathetic system is stimulated, dilated pupillae will contract, and because of contraction, it will cause mydriasis. So this is how the 4 muscles act. So sphincter pupillae contraction relaxation, dilated pupillae contraction relaxation. So in the cholinergic system, the first system is the cholinergic system. Yes, the cholinergic chapter we are studying now. So cholinergic system mein meiosis is due to contraction of it is due to, just a second, meiosis is due to contraction of sphincter pupillae. Done. That is parasympathomimetic drugs mein. Then parasympatholytic drugs mein it is due to relaxation of sphincter pupillae. There is mydriasis. In sympathetic drugs, there is contraction of dilated pupillae. That's why there is mydriasis. And in sympatholytic drugs or anti-adrenergic drugs, there is relaxation of the dilated pupillae. That's why there is meiosis. So meiosis and mydriasis is like this way. So you can say cholinergic drugs causes meiosis, anticholinergic drugs causes mydriasis, adrenergic drugs causes mydriasis, and anti-adrenergic drugs causes meiosis. So you have to learn these 2 causes meiosis, these 2 causes mydriasis. There are 4 chapters now. Cholinergic, anticholinergic, adrenergic, anti-adrenergic. So this is the mechanism of action, how these drugs are doing meiosis and mydriasis depending on the contraction and relaxation of the 2 types of iris muscle, contractor pupillae, sphincter pupillae and dilator pupillae. So which system is causing contraction and which system is causing relaxation of which of the following muscles. So they will cause accordingly meiosis and they will cause accordingly mydriasis. If you know the basics, you don't have to need to learn it. Done? Have you got it? Should I come on ciliary muscles? What are ciliary muscles? Can anyone of you tell me what are ciliary muscles? So can you see? Let me draw a diagram for you. What are ciliary muscles? Okay, I will draw it. So can you see? This is the cornea. This is the sclera, cornea and sclera. Just beneath the cornea and sclera, there is a layer known as choroid. So this is the choroid layer containing the pigmentation. This is the choroid and it will lead to iris. But before iris, there is ciliary muscle. This is ciliary muscle and this is iris. This is iris. This is iris. And the space here is the pupil. I have already explained a hole in the iris. So this is ciliary muscle. This one is ciliary muscle. Now what is the action of the ciliary muscle? When the ciliary muscle contracts, imagine this muscle is contracting and this muscle is contracting. It is circular. It is not two muscles. It is like a circle. So the whole ciliary muscle is when contracting, they will pull the iris here. They will pull the iris here. So this angle will increase. This angle, cornea and iris angle will increase. So what will happen if this angle is increased? In this angle, there is trabeculi. Channi jaise pores are present. Trabeculi is present. And the aqueous humor present here in the anterior chamber of the eye is drained from these pores. So if this angle is increased, more pores will be opened and more aqueous humor will be drained. So IOT will fall. IOT will fall if ciliary muscle contract. And reverse will happen if ciliary muscle is relaxing. So if ciliary muscle is relaxing, the angle will decrease. So pores will close. So less aqueous humor will go in the pores. So IOT will increase. So IOT decided by contraction and relaxation. Can you see? This is the ciliary muscle. So can you see? Here is the ciliary muscle. Let me draw it for you. Here is the ciliary muscle. Here is the ciliary muscle. So when they will contract, this angle increases. When they relax this, so let me cut the eye from here. So can you see? This is the ciliary muscle here. This is cilia. And can you see the angle here? This angle I am talking about, iris and cornea. So when this contract, the angle here increases from 10, 20, 30 degree. Can you see this angle? This angle I am talking about. So this is the angle here. This is the angle here. This is the angle. So when iris contracts, ciliary muscle contract, this angle opens here and these are the pores, trabeculi. So aqueous humor is drained from the sphincter. You can see this is the sphincter here. This is the trabeculi here. So aqueous humor is drained from here. So when iris muscle is contracting, it is causing meiosis. When ciliary muscle is contracting, the pores will open, the trabeculi will open and aqueous humor is drained out of it. So it will decrease IOT. This is the summary. If you have understood the mechanism, it's very good. If you have not understood the mechanism, it's really okay. You can understand the summary. This is the summary. So iris muscle and ciliary muscle are the two muscles. Both are present in our eye. Iris muscle contract, it causes meiosis. Iris muscle relax, it causes mydriasis. Reverse will happen if they relax. Done. Ciliary muscle contract, they decrease IOT. Ciliary muscle relax, it increase IOT. So currently I am talking about my first chapter, cholinergic drugs. What they do? Cholinergic drugs, what they will do? They will contract both muscles. So cholinergic drugs do the contraction of iris muscle. Cholinergic drugs do the contraction of ciliary muscle. Both. So in short, cholinergic drugs do meiosis in the eye. And cholinergic drugs decreases IOT of the eye. Since they decreases the IOT, they are useful in glaucoma. They are useful in glaucoma. Give me a thumbs up if you got it. Give me a thumbs up if you got it. Give me a thumbs up fast. Just a second. Okay. Okay. Done. So that is the thing. So they causes meiosis and they decrease IOT. Just second chapter, when I will teach you anticholinergic drug, they will relax both muscle. Anticholinergic drugs causes relaxation of iris also and relaxation of ciliary muscle also. Since they relax iris muscle, they causes mydriasis. And since they relax ciliary muscle, they increase IOT. That's why anticholinergic drugs are contraindicated in glaucoma. So that is a summary. So first two chapters का तुम्हें समझ में आया होगा. So that is about the eye. Let me talk about my first chapter. Stick to the first chapter, cholinergic drugs. So cholinergic drugs causes contraction of iris muscle and contraction of ciliary muscle. Since they causes contraction of iris muscle, they causes meiosis in the eye. Since they causes contraction of ciliary muscle, they open the trabeculi. So aqueous humor will be drained. They increase the angle, open the trabecular meshwork. So the aqueous humor will be drained out of it and they decrease IOT. That's why useful in glaucoma. So all the uses and adverse effects are hidden in this table only. So let me come to the next point, glands. All glands, whether sweat gland, salivary gland, lacrimal gland, tracheobronchial gland, gastric gland, the secretion of all glands is increased. All glands contain M3 receptors on them. So let me draw a face. So this is the face, this is the nose, this is the mouth. So this is the parotid gland I want to Draw here, just beneath the ear. Here is the parotid gland, salivary gland. So it contains M3 receptor. So all glands contain M3 receptor. And when acetylcholine come and bind with the M3 receptor on all glands of the body, secretion increases. So salivary gland, sweat gland, lacrimal gland in the eye, it also contains M3 receptor. So all gland secretion is increased. Done. That is the coming on the next organ, blood vessel. Glands is done. So all gland secretion increase. Heart rate mein everything is decreased. Smooth muscle mein muscle contracts, sphincter relax. Eye mein both the muscles are contracting. Iris also, ciliary muscle also. Now coming on blood vessel. Next organ is blood vessel. They causes vasodilatation of the blood vessel. Just learn it. They causes fall in BP. Because of vasodilatation, they causes fall in BP. Because of vasodilatation. And last is male sex organ. They cause erection. Now there are two things in sexual intercourse. Erection and ejaculation. So male sex organ, that is penis. Penis contains M3 receptors also, which causes erection. And it causes alpha receptors also, which alpha 3, which causes ejaculation. So erection is a parasympathetic process and ejaculation is a sympathetic process. I hope you got it. So that is the whole action. That is muscarinic action, nicotinic action. Nicotinic receptors are of two types, NM and NN. NM are present at neuromuscular junction. Here you can see. This is a muscle and this is a nerve. Only one neuron is there. So this is the cell body present in the CNS and this is the nerve and it is secreting acetylcholine at the junction. So it will cause contraction of the muscle. Done. Contraction of the muscle. So we are done with the classification. We have done with the mechanism of action. You know the two type of drugs, cholinergic agonist and anticholinesterase. These are the two categories. Anticholinesterase again of two types, reversible, that is carbamates, and irreversible, that is organophosphates. You know the name of the drugs. You know mechanism of action of both categories. Now among actions, you know actions of M1, actions of M2, actions of M3. M2 only on heart, M3 on many organs. So you know actions of each of them. Coming on uses and side effects. Let me start with uses first. Okay, polls. I'm skipping the polls because there is no time for polls. I will launch it in the ends. And so coming on uses. What are the uses? No, this is the whole table. Can you see this table? Everyone, please see this table. Everyone, I will tell you a unique way of learning uses and side effects without mugging up. I will tell you unique way of learning uses and side effect of all 4 chapters. Cholinergic, anticholinergic, adrenergic and anti-adrenergic. All 4 chapters I will tell you a very unique way. So what is my unique way? Just see. See, for the first chapter, cholinergic drugs. This is the table, right? You know the table correctly. If you learn this table now, there is no need for you to learn uses and side effects. Both will be hidden in this table only. So this table is M1, where M1 is present C, M2 present only on one organ, that is heart, M3 on 5 organs, on all visceral smooth muscles, eye, glands, blood vessels and male sex organ. So these are the 5 organs. Nicotinic receptor NM and NN. NM is important, it is present at neuromuscular junction. So if you learn this table now, in this table whatever good things are there, I will mark it as uses. So 9 uses, 9 circles will be there on this table. And whatever bad things are there, not useful for human, I will mark it as side effect. So 4 circles for side effect. So I will use different color. I will use red color for the uses and blue color for the side effect. So 9 red circles and 4 blue circles. So the chapter will be done. So let me start with uses first. I am starting with uses. So start marking in this table. So this is the master table. First circle C on GIT. What it is doing on the GIT? You tell me. It is causing contraction. So let me show you a GIT. So this is the large intestine ascending colon, transverse colon, descending colon. This is the anus. Ascending colon, transverse colon, descending colon, and this is the anal sphincter. This is the anal sphincter. This is the appendix. So what it is doing? Tell me. You will tell me. What it is doing? These drugs are causing what? It is causing contraction of the wall. Contraction, increasing peristalsis. That is, contraction means increasing peristalsis of the wall, and they are causing relaxation of the sphincter. So sphincter is relaxing and muscle is contracting. They are doing 2 things. So imagine the muscle, the whole muscle is contracting and sphincter is relaxing. So what will happen? Whatever feces are present inside, it will come out. It will come out because the muscle is contracting, causing peristalsis, and sphincter is just relaxing. So feces will come out. So these are useful in constipation. So all condition of constipation, it is useful. So tell me what are the conditions of constipation? Post-op abdomen. After surgery, patient presents with constipation, gastric atonia or gastric stasis or congenital megacolon. In all these conditions, it increases the contraction causing peristalsis and it causing relaxation of the sphincter. So that is why it is useful in this GIT disorder. So first use is GIT. Second use I have marked with second circle. You can see what it is doing in urinary bladder. Who will tell me? So let me draw urinary bladder. So this is the urethra and this is the sphincter. So what it is doing to the muscle? Who will tell me? It is same thing. It is contracting the muscle, detrusor muscle. It is contracting and it is relaxing the sphincter. So what will happen? Imagine the detrusor muscle is contracted and the sphincter is relaxed. Detrusor muscle is contracted and sphincter is relaxed. So what will happen? You will tell me what will happen. The urine will pass out. So micturition will increase. So it is useful in the disorders having urinary retention. So what all disorders have urinary retention? You tell me. So post-op retention. After surgery, patient have, after general anesthesia, patient have urinary retention. Postpartum, after vaginal delivery, patient, female patient, or after cesarean also due to anesthesia, she is having postpartum retention. And neurogenic bladder, there is urinary retention. So second use is urinary retention. So two uses are already done. So first use constipation. You should enumerate the conditions of constipation. Second use is urinary bladder contraction, that is urinary retention. You should enumerate the conditions causing urinary retention. Coming on the third thing is eye. Coming on the third thing in eye. In eye we have two things. Iris mate is causing meiosis and ciliary muscles mate is causing decreased IOT. Yes or no? Because of contraction of iris muscle, it is causing meiosis. And because of contraction of ciliary muscles, it is decreasing IOT. Since it is decreasing IOT, it is useful in glaucoma. What is glaucoma? Glaucoma is a disease in which the intraocular tension in the eye is increased because of more aqueous humor, more pressure of the aqueous humor. It is causing drainage of the aqueous humor. It is increasing the drainage by increasing the angle, increasing the trabecular meshwork. So it is decreasing IOT. And it is causing meiosis. So it is required to break the synecdoche. You know what are synecdoche? So these are available in the form of eye drops. Whenever we put them, you know what are synecdoche? Synecdoche is adhesions between the lens and the iris, or between iris and the cornea. So in this condition, in synecdoche, you want to put some eye drops which causes alternate meiosis and mydriasis. So sometimes it causes meiosis, sometimes it causes mydriasis. So for meiosis, so that alternate meiosis and mydriasis ki wajah se these synecdoche will be broken down. So for meiosis, we use these drugs. For mydriasis, we use anticholinergic. So we will give 2 drops to the patient. One day meiosis wali, one day mydriasis wali. So meiosis wali ke liye these will be useful. Done. So in the eye, for meiosis, for synecdoche, for alternate meiosis, mydriasis, for meiosis we give this drug. And in glaucoma, because it causes contraction of ciliary muscle, it decreases IOT. For glaucoma also it is useful. So constipation it is useful, urinary retention it is useful, in the eye, glaucoma it is useful, in the eye, for synecdoche it is useful. Coming on the next use. Next use is salivary gland. In salivary gland it increases the secretion. So the name of the disease here is xerostomia. What is xerostomia? Dry mouth. Dry mouth. There is a condition in which patient will come to you and say, doctor, I am having less saliva in the mouth. So my mouth is dry, always dry. I can't eat. I have problem in eating. My mouth is feeling dry all the time. So salivary gland production is less. So patient is having xerostomia. The disease is known as xerostomia. So you just give these drugs. These drugs increase the salivary gland secretion. All gland secretion. So salivary also. So they will be helpful in xerostomia. So constipation, urinary retention, glaucoma, synecdoche, xerostomia. Till now 4 uses are done. Coming on the 5th use based on M1 receptor. M1 receptor present in brain. In brain they cause memory. So these are useful in Alzheimer's disease. Alzheimer's disease. What is Alzheimer's disease? What is Alzheimer's disease? In Alzheimer's disease, in brain we have cholinergic neurons. In the brain we have cholinergic neurons which secrete acetylcholine, and this acetylcholine helps in memory. This acetylcholine helps in memory in the brain. So in Alzheimer's disease there is destruction of these neurons. So there is less acetylcholine and patient presents with dementia. Memory will decrease. Decreased memory is known as dementia. So what you will do if you give these drugs? Which among them? These 3. These 3 are neurospecific. Name the drugs. Rivastigmine, donazepam, galantamine. These 3 are carbamates, reversible inhibitors of cholinesterase enzyme. So rivastigmine, donazepam and galantamine. These are CNS, cerebroselective, CNS selective. So they will show their action only in CNS and they will decrease dementia. They will increase the memory of the patient and they are helpful in Alzheimer's. So the 5th use, I'm sorry. So enumerate again the 5, then I will come on the 6. Total 9 uses are there. Till now 6 are done. So first is constipation, because in GIT, now the disease is opposite. In constipation, it increases the peristalsis and do the opposite of constipation. The second is urinary retention. It increases urine flow. And that's why useful in urinary retention. The third is glaucoma and synecdoche in the eye. The fourth is xerostomia in the salivary gland. The fifth is Alzheimer in the brain. Because there is dementia, it increases the memory. And the sixth, based on sixth, seventh, and eighth. Next three uses are based on this function, nicotinic function. So neuromuscular junction, it causes contraction. You know contraction. So it is useful in myasthenia gravis. What is myasthenia gravis, by the way? Do you know what is myasthenia gravis? See the first diagram. See here. This is the cell body and this is the axon of the cell body. Axon of the cell body is known as nerve. This is a nerve. So cell body is present inside the brain, inside the spinal cord, in the CNS. Nerve is arising of it. So nerve is arising out of it and going to a skeletal muscle. The skeletal muscle, imagine it is my bicep. It is my bicep, it is my tricep, whatever it is, my skeletal muscle. Imagine this is this diagram inside me. So this is the skeletal muscle, you can see, skeletal muscle. So whenever nerve of depolarization, wave of depolarization is arising here, the wave of depolarization is coming, at that point, this nerve end will secrete acetylcholine. This acetylcholine will come at the junction, and on the skeletal muscle, NM receptors are present. These are NM receptors. This acetylcholine will bind with the NM receptor and my muscle will contract. So whenever I am thinking I want to contract it, see, I am contracting. So at that time, this whole thing is happening inside me. So nerve of depolarization is coming. The acetylcholine is secreted at the junction. It is binding with NM receptor present over here and it is contracting. It is showing. Just suppose this muscle is having 100 NM receptor. 100 NM receptor. So 100 molecules of acetylcholine are coming and binding one each with one NM receptor and muscle is showing contraction. Here what happens, the body in myasthenia gravis, the body forms autoantibodies which destroy NM receptor. The body is forming antibodies against its own receptor. So here most of the NM receptors are destroyed. So out of 100, patient is having only 10 or 20 remaining. Rest of the 80 or 90 are destroyed. So acetylcholine is adequate. Wave of depolarization is generating. Acetylcholine is secreted at the junction. But acetylcholine को bind करने के लिए there are no receptors. Receptors are very less. So muscle is not contracting properly. So patient will come to you. Patient will say, doctor, I am having weakness. I can't contract my muscles voluntarily. If I think I want to contract it, I am contracting. But if I am having myasthenia gravis, I will try to contract it but unable to contract it properly with same intensity. So that is the weakness is the main complaint. So development of autoantibodies against nicotinic receptors. So only 1/3 of them are remaining. Rest of them are destroyed. So patient presents with weakness and fatigability, especially in the evening. That is the problem. You can see this is the nerve ending. This is the acetylcholine molecules. And these are the receptors. Blue color are the receptors. So you can see out of 3, 2 are destroyed by the antibodies. Only 1 is remaining. So this acetylcholine will bind with this one, not with these two. Not with these two. So patient present with weakness. Done. So how these drugs are useful here? How these drugs, neostigmine and pyridostigmine is useful here. How? What these drugs will do? These drugs are anticholinesterase. So this acetylcholine once secreted here, this acetylcholine is destroyed by an enzyme. The name of the enzyme is cholinesterase. That enzyme destroys acetylcholine. Destroys. Problem is not with acetylcholine. If we give this drug, so this enzyme will be inhibited. Anticholinesterase drugs will inhibit the enzyme. So once the enzyme is inhibited, so destruction of acetylcholine will not take place. So acetylcholine will remain there for a longer duration. तो आपके रिसेप्टर तो कम ही है. यू आर नॉट क्योरिंग इंक्रीजिंग द रिसेप्टर तो अभी भी 100 में से 10 ही बचे हैं. रेस्ट 90 आर डिस्ट्रॉयड. बट जो 10 बचे हैं उस पे एसिटाइलकोलिन विल एक्ट फॉर अ लॉन्गर ड्यूरेशन. So you are not curing the disease. You are giving symptomatic treatment. Fever है, Crocin ले लो. It is like that way. So you are not curing the disease. You are not giving antibodies inhibitor. You are not giving steroids. Steroids यहाँ पे main treatment होगा. But you are giving symptomatic treatment. Give me a thumbs up if you got it. So these drugs will allow acetylcholine to accumulate at the junction and act on the receptor for a longer time. Because you are inhibiting the enzyme. Give me a thumbs up if you got it. Give me a thumbs up if you got it, everyone. So that is the 6th use. Just a second. That is the 6th use. So coming on the next use, 7th one. 7th one also based on this property only. That is neuromuscular junction. 7th use. So that is post-op decollorization. You know, during anesthesia, during a surgery, we give 2 things. I want to make my patient unconscious. For that, I will give anesthesia. And I want to relax all the muscles of my patient. I will give neuromuscular blocker. Neuromuscular blocker, one of the main neuromuscular blocker you used here is tubucuranin. D-tubucuranin. That is known as Curare. Curare is given for neuromuscular blocker. Yes, so patient is not moving here and there during the surgery. You want the patient to still on the OT table. So we give Curare. So the surgery is over. Surgery is done well. Surgery is over. We have shifted the patient from OT to the ward. But courier effect is still there. It is longer for a long time. So patient is out of the OT. He is in the ward. Still he cannot move his limbs. So patient will say, doctor, surgery is over. I am conscious now. Anesthesia is gone. But I cannot move my limbs. मैं हाथ पैर नहीं चला पा रहा. So to reverse decourirization, you will give these drugs. What these drugs will do? What courier is doing? It is NM receptor. Courier is blocking the NM receptor. This is courier. It is blocking the NM receptor. This is courier. It is binding the NM receptor. So muscle is not contracting during the surgery. So what these drugs are doing, you are giving neostigmine or pyridostigmine. So they will inhibit cholinesterase enzyme. So acetylcholine concentration will increase here. So acetylcholine will replace the courier and muscles start contracting. So that you are doing. So that is reverse the post-op courierization. Last use based on same nicotinic receptor. 3 uses here. One is myasthenia gravis. One is to reverse the courier, decourierization. And the third is cobra. You know snake, cobra. There is a snake known as cobra. So when the snake bite, the venom of this cobra, the venom contains courier only. So venom. So as soon as the snake bite, patient cannot run because all the muscles stop contracting. All the voluntary muscles, skeletal muscles relax. Just like anesthesia, just like surgery, it is courierization. So to reverse it, you will give this thing. So 9 uses, 9 circles. Who will tell me? Number 1, constipation. Number 2, urinary retention. Number 3, glaucoma. Number 4, xerostomia. Glaucoma, xerostomia, constipation, urinary retention. Number 5, Alzheimer. Number 5, Alzheimer. 6, 7, 8. 3 more. One is myasthenia gravis. One is courier. To reverse the courier. Courierization, decourier, and next is cobra. Next is cobra bite. So these are the 8 uses. Everyone give me a thumbs up. So 8 uses based on 8 properties of cholinergic drugs. I am done. And last is dhatura poisoning. Dhatura is an anticholinergic drug. To reverse it, we give cholinergic drug. Common sense. So 9 uses. Along with these 8 circles, write dhatura here. Dhatura or belladonna. So 9 uses and 4 side effects. What are the 4 side effects? Let me show you. Let me show you all together. So number 1 side effect is asthma. I cannot give these drugs in asthma because they cause contraction of the lung. और asthma में और contraction हो जाएगा तो attack precipitate हो जाएगा. So asthma they are contraindicated. I cannot give these drugs in hypotension or coronary artery disease because they further do more hypotension. Number 3, I cannot give these drugs in peptic ulcer because they increase the acidity. They increase the gastric acid secretion. Number 3, done. So these are the 3 side effects. So that is the summary. So you know the 9 uses marked by red color and you know the 3 side effects marked by blue color. So you know the side effects and uses. This is how I will teach you next 3 chapters also. This is the first chapter. Thank you very much. I have finished cholinergic drugs. If you have any doubt, write down in the chat box. Cholinergic drugs, I have told you the classification. I have told you mechanism of action. I have told you actions, M1, M2, M3, NM, NN, all 5 actions. I have told you uses. I have told you 9 uses. I have told you side effects. I have told you 3 side effects. These 9 and 3 I have marked in the table only so that no need to learn, just to understand. So cholinergic chapter is over. My next chapter is anticholinergic drugs. Anticholinergic drugs. Now notes are not available on YouTube, of course. If you want notes of this chapter and a detailed description of this chapter, this anticholinergic I will take tomorrow morning at same time 9 a.m. Daily at 9 a.m. I am having a pharma class. So anticholinergic drug tomorrow, a day after tomorrow, I will take adrenergic, uske baad anti-adrenergic, then we will take autocoid, serotonin, antihistaminic. So we will take all pharma one by one chapter every day, 9 to 10 every day. If you want notes of all these and a detailed more chapters on the pharma, so please, where it is available? It is available for free. But where? It is not available on YouTube. The notes are available on Unacademy Learners app. So install Unacademy Learners app from the Play Store. After installing, go to the NEET PG category. After going in NEET PG category, search my name. My name is Dr. Priyanka Sachdev. Search it. See the spelling in the background. Dr. Priyanka Sachdev. You will find my profile link there. Just follow my profile link. You will get a list of my lectures there along with the notes PDF. It is free. It is available for free, but you will require a code. Remember, the code is my surname only. That is Sachdev. So SACHDEV Sachdev 10. Sachdev 10 without space. It is the code. Please give this code to your batchmates, seniors, juniors. Please write the code on your batch group and help everyone. Distribute it to everyone. It is available for free. So all the pharma lectures are available there for free along with notes PDF. So after this lecture, just go there and see there how you are finding, whether you are finding it useful or not, and give me the feedback definitely. This is about free platform. On Unacademy, we have two platform, free and paid. Free के बारे में तो बता दिया. There is a paid platform on which we have two subscriptions, Plus subscription and Iconic subscription. Plus subscription, you will get access to Unacademy live and recorded lectures. In Iconic, along with Unacademy, you will get access for prep ladder recorded lectures also. So better to go with Iconic if you are taking a paid subscription. You can take Plus also, but better to go with Iconic. These are the batches available on the Plus platform. Separate batch for FMG, separate for Next, and separate for NEET PG. So we have separate batches for separate exam, and once you take the subscription, you will get access for all of them. This is a NEET PG 1 month package which cost only 4,500. You will get additional 10% discount if you use my code. This is a schedule for grand test. The grand tests are available, and every Sunday we have grand test on Unacademy. This is the schedule. You can participate in it if you take the subscription, and you will know your all India ranking every Sunday. So these tests are really very helpful. You have to practice till you become perfect. And last two offers for you. If you take a subscription for 12 months, you will get additional 2 months at the same price. If you take a subscription for 4 years, it is the most cost effective subscription. It costs only 60,000 for Plus and 75,000 for Iconic. These are other subscriptions available on Plus starting from 2 months. 1 month is also available temporarily, starting from 2 months till 4 years, and on Iconic starting from 12 months till 4 years. See the price of all the subscription. You can find out longer the subscription, cheaper it is. So see the price. Longer the subscription, cheaper it is. So if you are a first prof or second prof student, I advise you to take a longer subscription, at least 3 years or 4 years. It will be cheaper. Monthly installment is 1,200 only or 1,400 only. But if you are an intern, so you can take 1 month subscription also. So whatever subscription you are planning, whatever, Plus, Iconic, 1 month, 4 year, the code is same. If you apply my code, you will get discount. You will get discount. Sachdev10 is the code. You will get 10% discount if you apply it just before payment. That is my guarantee to you. And don't forget to follow my profile link. So code is useful for both students. Those who are watching my free classes, they will require this code to unlock the free class. So distribute this code to everyone, all the students, all the medicos you know in any medical college. So distribute it to everyone. They will unlock my free classes. And if you are thinking of a paid subscription, you will get discount if you use the code. So code is same for paid also, for free also. So thank you very much. Tomorrow I will start another chapter, anti-cholinergic drugs. So be with me. Okay, see you. Bye-bye. Just after 5 minutes on YouTube only, I am taking another lecture of PSM. I am teaching biostatistics of PSM. You can join me there just after 5 minutes at 10 o'clock. Okay, see you.